one. Dr. Moira Richards, talking about protecting newborns from infection. Really the best way to do this is kind of begins with mom during pregnancy.
Right.
What can you tell us?
There are 3 significant times that moms can help to prevent infection, and the first is getting good prenatal care. There is a common bacteria called Group B strep that 25% of all women carry that is normal for the women. But if the baby picks it up, can be severely affecting their breathing and sometimes can cause baby death. And so you should be screened for that before delivery because there is appropriate treatment during labor that can significantly decrease the risk of transmitting that infection.
And we are kind of, I guess, at the peak of when you guys tend to see a lot of infections in newborns. You're saying October to March area.
Right. We are in what's called RSV season or flu season. RSV is a virus that causes the common cold in most adults. Maybe that one that lasts a little longer than normal, a little more sneezing and stuff than normal. But the fluid that's produced in the lungs can sometimes obstruct the lungs of a baby, a newborn baby, and they can stop breathing and can actually pass away from that problem also. So it can be passed by contact, just touching. You touch your face, and 20 minutes later you touch the baby, and you can pass that infection to the baby. So it's very important to minimize contact, especially with people you don't know, when you have a newborn baby at home.
Which leads me to my next question of what can new parents do? You said you tell all your parents, stay at home for the first 2 months of this baby's life.
That's right. There's a couple things that are very important. The first is breastfeeding. Breast milk is transmitting all of mom's antibodies and protection against infection to the baby. So when people think breast milk and formula is the same, it's really not. You're actually giving your baby a treatment and a protection against infection when you're breastfeeding. Secondly, the antibacterial lotions and soaps that we use. The Center for Disease Control, or CDC, recommends we wash our hands and face with soap and water. Using antibacterial multiple times a day is not necessarily beneficial because if we use it a lot, the bacteria may get resistant to that. So clean with soap and water, and once in a while use the antibacterial lotions to sterilize.
And with these antibacterial products, they're not too harsh to use around a newborn?
No, they're not, because they really evaporate very quickly. As long as you don't feel the moistness on your skin anymore, it's essentially gone, and you can go ahead and handle your baby.
Dr. Moira Richards at TMC's NICU. Thank you.
You're welcome.